Get ready for Benjamin Knight Fuchs live on a Sunday late afternoon, early evening. Ben, how are you?
I'm doing good. How you doing, Liam? Good to see you. Hope you had a good week. I'm
Good to
excited
see you too.
I'm excited about our talk today on intermittent fasting, which seems to be all the rage. I've been talking about fasting for years, but over the last, I don't know, maybe 2, 3, 4, 5 years, it's kind of caught on, and there's all kinds of articles about it and books about it, and pretty much everybody knows about intermittent fasting, which I used to just call fasting. I don't know, the word intermittent is sort of crazy when you think about it, because what does it mean?
Yeah, well,
You just don't fast forever?
right. I kind of jumped on the train, on the fasting train. Was not sort of a big fan at first. You know, I was just like, eating is just such a good thing. And then I started to develop a strategy. And so I've been doing like a 24-hour fast, just like eating once a day, and then breaking that up sometimes to a 36 to 48-hour fast. So I just don't eat for 2 days.
Well, you know, go ahead.
It just when I first started, it was a little bit difficult. The hunger pains were pretty strong, but after you do it for a while, get into a rhythm, you don't notice it, and towards the end of the fast, man, you just feel so energetic, and you
don't even want to eat. It's like hard.
Yeah, you don't even want to eat. You don't want to blow. You don't want to blow the
exactly.
feeling.
Exactly. It's like it's hard to eat. But then what's really interesting is once you start eating, then you're on the wagon again.
It's like then you're on the wagon.
Then you're on it again, you know? Then you're eating, your eating behavior, it's like it kicks back in, and then you're normal. And the term intermittent fasting is just kind of silly or the term intermittent is sort of silly to me, because all fasting is intermittent. If it's not, it's starvation, right? The difference between fasting and starving is the intermittency. So all fasting is going to be intermittent. If you're not intermittent, then you're starving. So intermittent fast, I get people, right? It has to be intermittent. So there's different ways. There's fasting for 24 hours, like you say, for 12 hours, for 16 hours. Sometimes people will fast twice a week. Sometimes they'll fast every other week, one day every other week. Yeah, there's different ways of doing it. There's something called alternate day fasting, where you eat every other day and you fast every other day. But really, the whole idea is that you don't want to put energy into the body.
And before we move forward, Ben, I'd just like to say hello to Patty. She says hello, gentlemen, and we say hello, Patty, and to anybody out there listening, please feel free to comment as you wish.
Feel free to comment.
Okay.
Right.
All right, Ben, continue.
Patty, or if you have questions too. So all fasting is intermittent. There's different ways of doing it, but the basic idea is to give the body a break. You know, for eons, hundreds of thousands of years, the biggest problem human beings have was not getting enough calories, starvation. But over the last 100, 150 years, we have the exact opposite problem, over nutrition or overfeeding. And this overfeeding problem creates this an issue for the metabolic system. The body can't process all those calories. It can't process all that food. And this not only creates kind of like a backup in calories, which end up getting stored as fat, but it also creates a burden, oxidative burden on the cells, a stress burden on the cells. So you can basically think of fasting as taking a vacation, a metabolic vacation. Giving your body a metabolic vacation. It's really as simple as that. And sometimes I get kind of blown away when people say, well, how do I fast? And what do I do? And you just stop eating. You don't put food in the system. And it doesn't have to be an official fast, like a 24-hour fast. It could just be restricting your calories. It could be between meals. You know, even between meals, your body starts to recover, starts to adjust. And I think of the metabolic system as a seesaw. And the seesaw is even until weight is put on, and then it goes back down. You know, you put weight on one side and the other side goes up. You can think of the weight as food. So if your metabolic system is like a seesaw, it stays even. You put food in the system, it throws the seesaw off balance. The body metabolizes the food. It goes back into balance. You eat again. It goes back. It comes out of balance. And it's this constant out of balance, back to balance, out of balance, back to balance system or process that throws the body off. You don't want to be throwing the metabolic system off too frequently or too intensely. And this is what overnutrition is about. And as I say, for hundreds of thousands of years, we had the exact opposite problem that we have today.
Yep.
We had to worry about starving. Today, we have to worry about too much food. So fasting allows the body to relax, allows the metabolic system to catch up with all of those calories and all that energy. Food represents energy, calories represent energy that have been inputted in the system. And it turns out when there's no calories for the body to process, the body can clean itself out. This cleaning process is called autophagy at the cell level. And old cells and dysfunctional cells are cleaned out as the body gets to do its chemical processes without having to worry about metabolic disturbances. This is very ironic because almost all of our chronic health challenges are related to this phenomena of overnutrition, which tells you that once you slow down the input of energy into the system, you give the body a chance to kind of stabilize itself, all chronic degenerative disease symptoms will begin to resolve themselves. This is why fasting is so important. It allows the body to clean itself out. It allows the metabolic system to reestablish a balance, and it improves the markers of almost all chronic health challenges. Vascular markers, immune system markers, digestive system markers, metabolic markers, and pretty much all health challenges will begin to subside. The symptoms of all health challenges will begin to subside when you slow down the input of energy into the system. In addition to autophagy, when you fast or when you restrict your eating, the digestive system cleans itself out. And this is very interesting because you mentioned how you feel kind of hunger pangs a little bit when you don't eat. A lot of times we don't really need to eat, but we misinterpret signals from our body. For example, I think we've talked about this before. There's a neuromuscular complex that propels food through your digestive tract and out of your body. It's called the migrating motor complex, the MMC. The MMC slows down when there's food in the system, when there's food in the digestive tract, because you want to be able to extract the nutrients out of the food. If the MMC is constantly propelling the food out of the body, you won't get a chance to get the nutrients out of the food. So the system is set up so that when you eat foods, the MMC slows down. When you stop eating, the MMC kicks back in. The MMC, the migrating motor complex, has a sound, and it's perceptible. That sound is a rumbling in your tummy. Is that interesting?
That's the MMC.
Right? That rumbling in your tummy is a sign that your body is cleaning itself out, that your digestive system is cleaning itself out. But what do we do? What do you do what do we all do when we hear the rumbling in the tummy? We eat again.
We eat again, yes.
Thereby slowing down the MMC. And this is one of the causes of chronic constipation. In addition to this burden, this caloric burden of overnutrition. So the body will autophagize, the cells will clean themselves out, the markers of disease, inflammation, and metabolic markers will kind of subside. You'll get better digestion. You'll improve the elimination of foods through the digestive system. There are so many wonderful benefits to intermittent fasting. And we're talking about good food. If you want to throw in the lousy food, which most of us eat, right? Now, when you intermittently fast, you stop the input of toxicity, of oxidized fats, of preservatives, of food, of chemicals and excitotoxins and all the other things that are in the foods we eat today. So there's so many wonderful reasons why intermittent fasting is beneficial. It's easy to do. You just basically stop eating. The psychological part is really the hardest part.
Right.
And there's one issue that we're going to talk about here in just a moment that sometimes physicians or clinicians will advise their patients not to intermittently fast or not to fast. And there's one condition where that caveat will occur. And we'll talk about that here in a second. But why don't you put up some of these studies real quick? Intermittent fasting modulates the intestinal microbiota. Well, we know this is the first point on the triangle of disease, dysbiosis, disturbances at the level of the intestine. When you fast, when you reduce caloric intake, you will stabilize the whole metabolic system, but you'll also modulate the microbiome. You'll improve obesity, you'll improve energy metabolism, and all of this will play a role in improving the markers of autoimmune diseases and other inflammatory diseases, which are associated with caloric intake. Next slide. So you get better digestion, get better intestinal health, influence of fasting on intestinal permeability. And this is for patients who have rheumatoid arthritis. It turns out that According to the study, this was published in the Scandinavian Journal of Rheumatology, both intestinal and non-intestinal permeability decreased after fasting, but increased again upon subsequent eating behavior. So we know leaky gut or intestinal permeability syndrome is behind all health challenges, first point on the triangle of disease. And here we see that fasting will improve intestinal permeability in addition to improving the gut microbiome. Next slide. Early time restricted feeding, that's a fancy way of saying intermittent fasting. Time restricted feeding improves insulin sensitivity, blood pressure, and oxidative stress, even without weight loss. So you don't necessarily have to lose weight. You're going to improve metabolic markers like insulin sensitivity and blood pressure and oxidative stress, which is the second point on the triangle of disease, insulin sensitivity. So we see the first 2 points on the triangle of disease will benefit from intermittent fasting. And of course, that means everything's going to benefit because the first 2 points on the triangle of disease, according to the triangle of disease theory that we've talked about so much, leads to everything else. So by intermittently fasting, you're going to address the first point on the triangle of disease, the second point of the triangle of disease. Next slide. And then we come to the thyroid. We actually had another study here, which we had some technical issues. Maybe I'll just talk about this one real quick. This one is from the Journal of Clinical Endocrinology and Metabolism, Effects of Fasting and Glucose Load on Free Cortisol Response. It turns out that you also stabilize and lower cortisol levels when you intermittently fast. And then, of course, that's going to lead to the next slide. That is going to lead to improvements in thyroid health from the South Asian Guidelines for Management of Endocrine Disorders. And Ramadan, for those who don't know, is a holiday, a Muslim holiday where they fast every day. They eat at night, but then they fast during the day. In the month of Ramadan, patients with thyroid disease most of the time do not need treatment adjustments and can fast safely without health hazards. The reason this is important is because, and this is what I was alluding to at the beginning of our talk here, there are clinicians who will say, don't fast if you're hypothyroid, because it turns out that when you fast, thyroid hormone drops. But that's not a bad thing. And when you're hypothyroid, you're obviously not making enough thyroid. That's a thyroid hormone. That's what hypothyroid is. Hypothyroidism is. And so the clinicians will say, well, when you're fasting, you're lowering your thyroid hormone. Well, you're lowering your thyroid hormone because you're lowering your thyroid hormone requirements. So yes, you're lowering your thyroid hormone, but you're also lowering the requirements for thyroid hormone because the system slows down. And this is one of the mistakes clinicians make when they just look at numbers. They don't look at the entire metabolic system. So they'll say, oh yeah, fasting will lower your thyroid hormone. And if you've got hypothyroidism, you don't want to fast. Not true. Fasting, by virtue of calming the body down, yes, it will lower thyroid hormone, but it will also lower the requirements for thyroid hormone. And by virtue of its benefits on the digestive tract and on the microbiome, it's going to improve autoimmune function, autoimmune disease. So thyroid function will improve there. Hashimoto's thyroiditis is the most important form of hypothyroidism. By stabilizing the blood sugar system, the energy system, it will also improve thyroid health, and also by lowering cortisol, at least stabilizing cortisol, it will also improve thyroid health. So when you hear a clinician or a medical professional say, don't fast if you're hypothyroid, you got to tell them, well, yes, I understand my thyroid hormone is going to drop, but so will my metabolic requirements for thyroid hormone. So it's simple to do. Intermittent fasting is super simple to do. You simply stop eating. Now, there are a couple things that I should mention. I always get this question, can I take my supplements when I'm fasting? The answer is yes. You can take nutritional supplements when you fast. It's not going to hurt you to take a day off from your nutritional supplements. But remember, the fasting process is there to keep calories out. There's no calories in nutritional supplements. Perhaps there's a little bit of a few calories in essential fatty acids, but really it's not a caloric burden to take nutritional supplements. So yes, you can use your nutritional supplements. You do want to make sure that you're hydrated. So when you're fasting, you want to be drinking water. Now, water will do a couple things. First of all, water will fill you up. Secondly, a lot of times when we eat, we really are thirsty. And you can experiment with this yourself. The next time you feel like you're hungry, try drinking a quart of water or half a quart of water, 16 ounces or 8 ounces of water. And you'll notice, for the most part, that you're not as hungry. So sometimes the hunger or the dehydration signals are misinterpreted as hunger signals. So water will fill you up. Water will improve detoxification. And remember, as you're fasting, your body is cleaning itself out. So by drinking water, you'll improve detoxification or support detoxification that occurs with fasting. And then also, a lot of times when we think we're hungry, we're actually thirsty. And by drinking water, you can kind of cut into those hunger pangs. So you take your supplements, drink lots of water, and don't worry about hypothyroidism if that's the case. And remember, not only does reducing your caloric or intermittent fasting help with the markers of chronic degenerative disease, but it also will increase your lifespan. The less we eat, the longer we live, especially as we get older. Eating is for younger folks, we'll say. Eating is for kids, really. As we get older, our need for calories is less and less. So fasting will help support a reduced caloric intake for improvements in the markers of chronic degenerative disease, particularly autoimmune diseases. And fasting will add years to your life. It will protect your intestine and improve intestinal health and the health of the microbiome. It will improve metabolic syndrome symptoms. It will lower cortisol as well. It's an amazing practice. It's easy to do. It's cheap. In fact, it's free. In fact, you'll actually save money because you won't have to go out and buy food. And as we said earlier, you actually feel really good once you get into the rhythm of it. And by the time you're at the end of your fast, you almost don't want to eat. In fact, I've had to force myself to eat at the end of a fast. Although, as I said, once you start eating, you're back on the eating wagon. So intermittent fasting, awesome way to add years to your life and to improve the markers of chronic degenerative disease.
That was outstanding.
Thank you.
I learned so much. So it's you're not just cleaning. How do you say autophagy?
Autophagy.
Autophagy.
Phage, P-H-A-G, phage means to eat. Auto means self. Autophagy means self-eating. So essentially, the body cleans out all of its cells, self-eating or autophagy. And this is one of the most important benefits to intermittent fasting. In addition, as I said, cleaning out the digestive tract and activating the migrating motor complex.
But what you said that was so profound is that not only are you, the MMC, right? Not only slowing down that, but all types, and it makes so much sense if you're suffering from a chronic condition that will also naturally slow down the symptoms.
Yes. And I often talk about this book by a doctor. I know I've told you about it before. Dr. Terry Walls wrote a book called The Walls Protocol, and she actually used fasting and caloric restriction to cure herself of multiple sclerosis, MS.
And she was in a wheelchair, right? And then a year later, she's on her bicycle.
Yeah.
She talks about how first time she got on her bicycle after being diagnosed, she was weeping. She was so filled with.
Isn't that amazing? Isn't that amazing? Yeah.
Great
food
story.
is the hardest thing the body has to do. In fact, the main thing the body does is convert food into us. I mean, when we think about it, Liam, isn't it amazing that yesterday's lunch becomes your arm? Right? Isn't that an amazing thing?
Yeah.
We take that for granted. How does that even happen, right? When you eat a food, and this is kind of cool too, when we eat food, most of it gets excreted. It's supposed to get excreted, if we're healthy. And about 1% or even less of that food goes into our body. But that food that we say goes into our body, check this out. It literally becomes our blood. Our food, the food that the body takes in, becomes the blood. It merges with the blood. And from that point, the blood then distributes all of the power, the energy, which is represented by the nutrients in the food, to create our bodies, to create who we are. We are the end result of yesterday's pizza, right? Or
magic.
Or yesterday's broccoli. Isn't that magic? That's exactly what it is. It's magic. And that's why food has to be so respected. But over the last 150 years, because food has become so abundant, calories have become so abundant, we've lost our respect for food. When food was scarce, we had much more respect for it. We honored it more. It was a precious commodity. As calories have become and food has become abundant, it's lost its preciousness. And because it's lost its preciousness, we don't pay attention. We don't treat it with the respect that it deserves and that it needs. Because if we don't respect our food, it's not going to respect us. And that's the end result of food not respecting us and us not respecting food is our epidemic of chronic degenerative disease. And over the last couple of years anyway, our decreasing longevity and our dramatic reliance on pharmaceuticals and on medical intervention and on the medical model in general.
And okay, I have one last question. You know, to do my intermittent fasting, I was doing a lot of research, and they talk about how important it is to break the fast, you know, slowly. And I like you talk about. There were times in our history where we wouldn't eat because we didn't have the food. The hunters, they went out to hunt for the food, and we're waiting for them to come back. And so I figured, you know, in ancient times, we didn't, you know, break the fast slowly. When there was food, we ate.
You ate. Exactly.
We ate. So what are your thoughts on breaking the fast?
Yeah, you want to break into it easily. So very small portions, sometimes even just a couple of bites is enough to break a fast. And then nutrient dense and easy to process. Things like vegetable juices, for example, or perhaps a whey protein drink, or yogurt is great.
Soup.
Or chicken broth, yeah, chicken broth or coconut water. You want to avoid anything that's super processed, super high in fat, or fried fat especially is terrible for you. Probably stay away from too much fiber. And obviously, you always want to do this, but especially when you come back from a fast, you want to make very, very sure you're not eating something that will spike your blood sugar super high, like a soda pop or candy or cake or something like that. So stick to very bland foods, very easy to process foods, nutrient dense foods. Eat small amounts of it and gradually build yourself back up to the way you normally eat. And then also, you don't want to necessarily make intermittent fasting a really major thing, although you want to intermittently fast periodically, intermittently. During the week, you also want to keep your calories down. So it's not just the full-blown fast that's beneficial. It's any restriction or reduction in calorie intake, in caloric intake is going to have that benefit. Yeah, fast is great because it represents a dramatic reduction in caloric intake, but even a minor reduction in caloric intake is going to have a benefit. And this is why the ketogenic diet is so beneficial. You know, the ketogenic diet is actually a fasting diet. Do you know how the ketogenic diet was developed? This is kind of interesting.
Yeah, I have no idea.
Right? The ketogenic diet's been around since about the 1920s or so. And the ketogenic diet was developed because people didn't want to fast. So, and they knew that fasting was very good for seizure disorders.
Okay.
Now, why would fasting be good for seizure disorders? Historically, it's even in the Bible, I think. I think they used fasting, at least in biblical times, they used fasting for seizure disorders. Why would a fast, when you think about it, why would a fast be beneficial for seizures? Well, it calms everything down. Seizure disorders are caused by short circuits in neural energy and electrical energy in the brain. And these short circuits create a dysfunction in how energy flows through the brain, and the result is a seizure. So by fasting, you don't put energy into the system. You don't put energy into the brain. Everything calms down. So they've known for a long time that fasting had benefits for folks that had epilepsy and convulsions and seizures. But people didn't want to fast. So they did some analysis on the biochemistry, the blood of people who were fasting, and they created a diet that would mimic the biochemistry of fasting. And that diet that mimics the biochemistry of fasting is the ketogenic diet. When you think about it, check this out. When you're fasting, your body is deriving energy from fat. Not fat from food, fat from your body.
From your body, right?
Fat from you. And this is what the ketogenic diet is. The ketogenic diet is a diet that encourages the body to derive energy from fat by restricting carbohydrates. By lowering carbohydrates and to a certain extent protein and increasing the fat, it shunts the body into deriving its energy from fat, which is basically what happens when you fast. Now, when you derive your energy from fat, you produce these wonderful beneficial compounds that are important for the brain, important for the heart. They're called ketones. They're important for the brain. They're important for the heart. They're important for the digestive system. They're important for cells in general. So the ketogenic diet is a fasting mimicking diet.
Wow.
It doesn't require you to have to fast.
Incredible.
Now, fasting is still the best way to do it, but even reducing your calories, particularly reducing the calories that are derived from carbohydrates, will give you many of the benefits of fasting, and that's what the ketogenic diet is.
Outstanding. I mean, I've heard about the ketogenic diet for so long. This is the first time
Yeah. And by the way, if you know anybody, a lot of times people don't who have epilepsy or can get seizures, they don't respond to anti-seizure medicine. So if you know anybody who is not responding to anti-seizure medicine, or if anybody out there is listening has seizures themselves and is not responding to medication, you should know that simply restricting your calories, practicing fasting, and going into the ketogenic diet can act like a pharmacological strategy without having the pharmacological side effects. And anticonvulsants like carbamazepine, Tegretol, and phenytoin or Dilantin are not only are they really old drugs, they're especially nasty drugs. And with some of them, you have to have your liver tested periodically to make sure that you're not going into liver toxicity. So if you know anybody or you're on anticonvulsant medication, you want to lower the dose, or you perhaps want to get off of it, you might want to think about caloric restriction, the ketogenic diet, and intermittent fasting as a strategy, a non-pharmacological strategy for helping you deal with seizure disorders.
Powerful information. All right, we have a one last comment here.
We have comments.
Luda.
Oh, there's Luda. Luda, you got to call me. Luda had a question for me. Maybe we can talk to. I don't know if Luda wants to talk here. You can call me, Luda. Nice to see you. Nice to see you, Patty. And good to see you, Liam.
Good to see you too, Ben. Fantastic information. So everyone, put your questions and comments in the platform you're viewing us on. Powerful information. This was an awesome, awesome podcast. All right, everybody. Thanks for watching, and we'll see you next time.